welcome to meeting number 34 of the House of Commons Standing Committee on Justice and Human Rights. Just a few housekeeping notes. Today we have MP Jean Yip, who is replacing MP James Maloney. Welcome, Jean. Et Stéphane Lauzon est de retour pour...
And Stéphane is back to replace Mike Calloway, Stéphane Lauzon. So good morning to Stéphane.
Also have MP Tucker, who is replacing MP Carolyn Finley. Welcome, Corey. It's great to have you on our Justice Committee, I think, for the first time. So we are continuing our study on elder abuse. And so to ensure an orderly meeting today, I'll just go over some rules for the witnesses and for the members. Interpretation services are available to everybody listening just on the bottom of your Zoom screen. Make sure that you've selected the language that you'd like to listen to. You can speak in any of our 2 official languages. And if you do need to get my attention, just use the raise hand function at the bottom of the screen as well, and I will call on you. Before speaking, please wait until I recognize you and ensure that you unmute yourself, which is again at the bottom of the screen before you start speaking. Speak slowly and clearly, and once you're done speaking, please ensure that you are back on mute. And a reminder that all comments by members and witnesses should be addressed through the chair. With regards to a speaking list and a speaking order, Mr. Clerk and I will do our best to maintain an orderly meeting. For the witnesses, just for your reference, I have a 1 minute and a 30-second time card that'll help you keep track of your time. And just before we start with introducing our witnesses today, I'd like to get the committee's approval for the operational budget that was distributed to members yesterday. The budget is in the amount of $4,100, and it will serve to pay for our expenses for this current study on elder abuse. Do I have everyone's approval? I'll see a thumbs up from members. Wonderful. Thank you, everyone. I appreciate that. So now I'd like to welcome our witnesses as an individual. I'm not sure if Mr. Mathieu Robitaille has joined the meeting yet, but he is one of our witnesses. He's a community. Accidentally muted myself there. He is a community intervener at the Centre d'Action Bénévole Saint-Jérôme. We also have the Canadian Association of Social Workers, represented by Hai Lu, who is a content expert and associate professor, Faculty of Social Work at the University of Manitoba, and Patrick Fleming, who is the content expert and social worker. Welcome to both of you. We also have PAC Pioneers Community Organization of Canada, represented by Tehmina Navid, who is the executive director. Welcome to all of you. And just before we get started, Mr. Clerk, I'm wondering if Mr. Robitaille has made it in yet? I don't see him on the screen.
So he has not made it in yet. Oh, he just came in on the attendees list. I will promote him to panelist.
Wonderful. So we'll perhaps start with the Canadian Association of Social Workers for your opening remarks for 5 minutes. Please go ahead and unmute yourself.
Good morning, and thank you for the opportunity to appear before this committee and for inviting us to provide social work perspective on this important study on elder abuse. My name is Patrick Fleming, and I'm here on behalf of the CASW. I work at the London Health Sciences Centre Geriatric Mental Health Program, and I'm happy to be here today with my colleague, Hai Lu. The Canadian Association of Social Workers is a national association voice for social work in Canada with a dual mission to promote the profession and advance social justice issues. Our profession emphasizes the inherent dignity, worth, and agency of all persons. CASW strongly supports and emphasizes the urgent need to work collectively to address and prevent elder abuse. Elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust that causes harm or distress to any older person. With their varied roles throughout our community, social workers are uniquely positioned to offer insight on this issue. CASW has long been active in advancing policy proposals and frameworks that align with our social justice mandates. while aiming to see Canada meet the social determinants of health. Policies such as the Universal Basic Income and Social Care Act have a powerful to address and combat the underlying root causes that often lead to elder abuse. Foregoing these vital social policies can create and perpetuate situations in which older adults experience abuse. The Canadian Charter of Rights and Freedoms makes it illegal to discriminate on grounds of age. However, Canadian law is not grounded in a single definition that applies to elder abuse or neglect. Risk factors for elder abuse include stress related to caregiving, social isolation, limited cognitive ability, mental illness, poverty, ageism, and the overuse or abuse of illicit drugs and or alcohol. As well, the diversity of aging Canadian populations such as newcomers, racialized groups, Indigenous peoples, and 2SLGBTQ plus groups further complicates the prevention and intervention of elder abuse. Social workers are painfully aware of the prevalence and impact of elder abuse across Canada. However, data and statistics are woefully lacking. The most recent and authoritative national study on the abuse against the elderly was conducted in 2004. The Government of Canada has taken essential steps in the right direction in providing by expanding the guaranteed income supplement and old age security, as well as increasing funds for home care and more. These are essential steps, but they don't go far enough in providing the support this population requires and deserves. I would now like to pass over to my colleague, Hai Lo, to provide further comments.
Thank you, Patrick. Good morning, everyone. My name is Hai. I'm Associate Professor at Faculty of Social Work, University of Manitoba. I'm also a research affiliate at Center on Aging. As the committee members are aware, the provinces and territories have various acts and legislation to protect residents' safety and rights living in a communal setting. The COVID-19 pandemic has brought needed attention to how we care for Canada's seniors. Although the crisis in long-term care is dire, the reality is that most older adults live in communities. This means that both contexts must be robustly addressed. There are trends of underreporting, unawareness, and fear that make it challenging for older adults to receive the justice and support they require. There are many excellent existing programs and initiatives doing vital work, such as local elder abuse networks. However, these networks receive little to no funding. We know that a coordinated approach requires sustained infrastructure. Finally, the current patchwork of laws, regulations, and definitions is a significant problem. The absence of synchronized and comprehensive efforts, stable definitions, and robust tracking and reporting means Canada will not tackle this issue. Without a coordinated approach to ensure economic and social well-being, older adults in Canada will continue to experience poverty, homelessness, and social isolation. Any additional efforts to combat elder abuse will not be successful if these underlying factors are not addressed. Consequently, CASW recommends the federal government first and foremost develop a funded multi-year national elder abuse strategy. This overarching strategy must complement and support current federal and provincial efforts and have structural formal links to work in collaboration with the National Home Care Strategy, poverty reduction, and housing strategies. Additional recommendations can be found in our brief submitted to the committee. From the social work perspective.
Thank you, Ms. Lo. Unfortunately, hopefully we'll get the rest of it out during the question answer period. I do understand that Mr. Robitaille, I saw that your hand was raised. If you are here, you can turn your camera on. I'm having a hard time locating you on my screen. Nope, we just lost him again. So now we'll turn to Ms. Naveed from the PAC Pioneers Community Organization. Please go ahead, you have 5 minutes.
Thank you very much for giving me this opportunity to share our observations and with this Justice Committee for the elder abuse study. My name is Tehmeena Naveed, and I am the Executive Director of Park Pioneers Community Organization of Canada that serves the community on the whole and the South Asian community especially for the past 10 years. We focus on helping seniors of South Asian origin to stay connected with people of their age group and prevent social isolation. For this purpose, we've established an older adults group by the name of Senior Pioneers Club. We're based in Mississauga and serve the GTA, including Milton and Brampton area. During our involvement with the community, we have organized many seminars, workshops, and lectures on elder abuse prevention and published a documentary short film on YouTube to aware as many elders as possible about the signs of elder abuse and whom to contact for help. During our short time period of serving the community, we've been indirectly informed by the people of any victims of abuse and have shared contact information with them to get the help they need. There's a lot of difference between the South Asian and the Canadian culture when it comes to the expectations of the parents from their children. The South Asian parents expect their children to take full responsibility of caring for them in their old age, as they have educated and fully financially supported them in their younger age. However, when the children sponsor their parents to Canada to live with them, the seniors go through the cultural shock, are not very fluent in English language, and become dependent on their children, especially when dealing with the banks or any other government departments. Their basic rights and needs are often neglected and are made to feel like a burden on their own children. Older adults are dependent on their children when it comes to the financial management of their wealth because they may not have access to their bank accounts directly or are unable to do the online banking. So either their children do or some relative manage their accounts, and that's how they misuse the funds for themselves, thus financially abusing the parents. We have come to know of a few seniors complaining that they just get $100 or maybe a couple of $100 for their monthly expenses out of their old age benefits or pensions. And the rest of the amount is taken by the children because they say that we are keeping you in our house, we're taking care of you, we are giving you food and other necessities of life. So you don't need any extra money for yourself. When an older adult faces fraud or some financial scam, they do not know where to go and whom to complain due to the lack of awareness, which causes depression and a lot of stress, which leads to poor mental health. Majority of the victims of fraud and scams do not tell any of their family members as they feel embarrassed and ashamed. The justice system takes a lot of time, which means the seniors will take more stress knowing their money is all gone, which worsens their health condition and may lead to them ending up in the hospitals. So the person who has lost all that money because of the fraud is usually in great need of money, and they must wait a long time for the justice to be done. To help prevent all this from happening, we must work on getting justice delivered faster so that the seniors don't end up in the hospitals and face more emotional stress and declining mental health. It has also been observed in the South Asian community that the seniors who are living with their children are not usually allowed by the children to go out on their own, especially in the winter, as they may encounter any accident or may slip and fall, and then children would have to bear the medical expenses, or they will have to take care of their parents, which is an extra liability on them with their work and responsibility of the children. It's very hard for them to do that, and they end up restricting them to stay inside the house. As the older adults are dependent on the children, they usually make the seniors babysit their kids full time, ask them to pick up and drop the children, for which they have to stay at home all the time and cannot go out to meet friends or socialize or network with other people, and that also makes them feel isolated. Seniors are also experiencing physical abuse and sexual abuse, but the South Asian seniors do not report sexual abuse or even share that with anyone, not even their friends, as they are ashamed of it due to the cultural barriers. This is also why we do not have exact numbers and data as many as many are not comfortable disclosing their information. So we work to connect them with the organizations who are working professionally in this field. Our organization would suggest the government to make policies to ensure a safe environment within elder care facilities and individual seniors' homes by providing financial support, establishing senior homes which are focused on specific ethnic communities to serve visible minority groups and provide culturally sensitive services. This will also help reduce some of the fear that has been instilled in the seniors by the children of the abuse they would face in these homes, which leads to them further tolerating various forms of abuse within their respective homes. So it is. Okay, thank you so much.
Thank you very much, Ms. Naveed. Hopefully the rest of your testimony comes out in questions. So we are still without Mr. Rabit Hai. So we'll go ahead into our rounds of questions, and should he join at a later time, we'll squeeze him in between our questioning. We're starting with Mr. Cooper from the Conservatives for 6 minutes. Please go ahead, Mr. Cooper.
Great. Thank you very much, Madam Chair, and thank you to the witnesses. I'll direct my first question to Mr. Fleming. Mr. Fleming, you cited the woeful lack of data, and I would just be curious if you could speak to that more broadly and why it is so important that we have that data. And I would note that in the mandate letter to the Minister of Seniors, investing in better data collection and law enforcement related to elder abuse is featured prominently, and yet we've seen really no action on the part of the federal government when it comes specifically to data collection in a law enforcement context when it comes to seniors. Can you speak to that?
Well, I can speak to the fact that, one, we don't have a specific universal definition of elder abuse. So that in itself, in a sort of data collection, makes that challenging. The other I'm going to speak sort of both locally, provincially, and nationally, in that because there are no clear policies and protocols in tracking issues of elder abuse, and I'll use the example of, for instance, in the province of Ontario, there's only 2 pieces of legislation that actually mandates reporting elder abuse, and that's the Long-Term Care Act and the Retirement Home Care Act, and so. In many spots across the country, there is no mandatory reporting of abuse to older adults. So a combination of that and that there are no specific protocols put in place for agencies and services to collect that data. In talking to different police services, I mean, their challenge is, again, you look at the Criminal Code Act and what would be forms of abuse or breaking the law in that. There are many forms of elder abuse that occur that do not, quote, within the Criminal Code Act, break the law. So that also, from police service to police service, how they track information and how they see situations occurring, if they connect age to it, or if it's just a broad base of that there's been fraud or burglary or assault or things like that. So part of that, so that's where some of the challenges is that some of the services may not actually have it age connected as opposed to just event connected.
Thank you for that. And you cited the lack of a clear definition of elder abuse. And I think Ms. Lowe, you mentioned the same in your testimony. So to either of you, could you speak to that? And when we look specifically at the criminal code, do you think it would be helpful in future criminal code amendments that there be a clear definition of elder abuse?
Lowe?
Yes, I can speak briefly to that. Yes, I would definitely support that. Although it is very difficult to have a universal definition because right now in the criminal code, there is no inclusion of such as verbal abuse, emotional abuse, or neglect. So yes, I would I would support that, but I'm not a legal expert. I would support that idea, but I am hoping that other professionals will be able to take up that piece. Thank you.
Great, thank you for that. Maybe, just speaking broadly, as you see it, is it when we look at the criminal code, for example, because that falls exclusively within the jurisdiction of Parliament, do you see, you've cited some gaps in the code, but broadly speaking, is it a criminal code issue, a lack of tools? I guess in part it is. A resource issue, a reporting issue, and what are some of the things that you're finding, or certainly social workers and nurses are finding on the front lines, and how might Parliament or the federal government work to address those? It's a broad question, but I'd be curious.
I could answer briefly to that, and if Patrick has anything to add, please do so. Because actually I have two other paragraphs to finish in my report.
Go ahead.
And the CSW is proposing to have a collaborative national strategy to work on that. Legal definition is definitely one important issue, but another thing is all related agencies should work together to get training and to do public education on the signs and risk factors for for elder abuse. And in the literature, it is reported, it's documented across many different studies. For every case, elder abuse reported case, there are 5 cases remain unreported. And then the general
Point of order, Madam Speaker.
Oui, Monsieur Lauzon.
Yes, Mr. Lauzon.
Congratulations, because we have a mic open somewhere, one of the members.
Okay, thank you for pointing that out. Can I just ask witnesses and members to please mute your mics? Mr. Clerk, if you can give me a little bit of guidance here in terms of the interpretation issue.
I think Ms. Naveed has her mic on.
Ms. Naveed, can you please turn your mic off?
Madam Chair, the interpretation has resumed. Thank you.
Perfect. Thank you very much. So, Mr. Cooper, you have 30 seconds left on the clock. I had stopped it at the time.
And I think Ms. Lowe was still in the process of answering, so
Please go ahead, Ms. Lowe.
Allow her that time.
Oh, thank you. I just wanted to add one last point, that the estimated prevalence rate across studies is 16 to 18% in every country, in every study in Canada and North America. So based on that estimation from the literature, I think some legal efforts are needed here. Thank you.
Thank you very much. Thank you, Mr. Cooper. We'll now go on to Madame Brière for 6 minutes. Please go ahead.
Madame la Présidente.
Oui, Monsieur Fortin.
Point of order. Just before Mr. Brière, Ms. Brière starts, Mr. Robitaille has arrived. He hasn't been able to make his opening speech, so could we perhaps allow him to make his opening speech so that we can put questions to him as well? Of course, it's up to you, but I think that would be useful if we could hear from Mr. Robitaille now.
Monsieur Fortin, that is excellent suggestion. So we will stop here and go to Monsieur Robitaille for his opening remarks for 5 minutes. And just as a quick introduction, Monsieur Robitaille is the community intervener at the Centre d'Action Bénévole Saint-Jérôme. Welcome, and please go ahead and unmute yourself. You'll have 5 minutes for your opening statement.
Bonjour tout le monde.
Good morning. I'm happy to be here. So I've been asked to introduce myself and talk about my experience with vulnerable seniors and that are at risk of suffering violence or abuse. By experience, well, I don't have statistical data or figures that I can provide, but I'm happy to hear others talking about that aspect. But based on my experience and what I've seen is that there are many seniors that become vulnerable because of the system that exists, either because of the financial system with the government. And unfortunately, I can't put up my mic. I'll try and speak a bit louder if that can help you. So the majority of elders that I meet with in my working life have lots of financial worries, and that causes other worries for them. And here I'll give you an example of a case with the CERB where members of their community asked this elder person to make a request, and she received $19,000 from the CERB. And that's the amount of money that she normally gets as a guaranteed income supplement plus the OAS. And so what's probably going to happen, and this is causing concern for her because she got all this money from the CERB, she's afraid that she will have a cut of $8,000 to $9,000 for the next year for her pension, and that will mean that she'll be in a very precarious financial situation. And I can give you another example of a situation that happened about 2 years ago now. There was a person had a problem with her tax filing, and in the Centre d'Action Bénévole we have volunteers with the project who actually do the tax filing for people who are in a low-income category, and we continue to help them throughout the year if they're late with their filing. And we try and correct this situation with them. The government is aware of this situation and there's corrective measures that can be brought. But for a year now, and almost 2 years, in fact, now, the corrective measures have not been taken, despite the fact that we've asked for this correction to be made. So this person is not able to get this money back. So that means for a year now, they're already in a precarious financial situation because there's something that's not been corrected further up the chain. So it becomes a bit of an abusive situation for this person because she's the one who's experiencing these difficulties because this correction has not been made. So that's why I'm saying sometimes this situation is caused by the system that exists. That's the sort of situation that happens further down the line. So I think at one point in time, we have to try and see what's really essential within the system to help elders and to stop that type of situation arising with difficulties with the government. I've got another example that I can share with you now. And I know that here I'm talking a great deal about the federal government because I'm in front of you here today. But another situation that happened with someone, well, I'm just looking for how to express this. There's lots of seniors that when they have to identify themselves, they have to turn to two levels of government. But when we make a call, it takes a long time. And I go to help the old people to make these calls. It's already problematic for them to do that. It took us 1 hour, in fact, on 4 or 5 occasions to be able to sort out a situation for asking for their old age pension, because when you make the application, you can do that 10 months in advance, but we heard that the processing time was 2 months before the deadline, and once the deadline runs out, a week or two before that, we heard that this person wouldn't have the full amount because perhaps she earned more beforehand. So we need to then submit another document so that this person can get their full amount. So that puts them in a precarious situation compared to other people who may then decide to abuse that person who's in a precarious situation. So we try to not contribute to that. I know we talk about the legal side of things, but downstream we have to ensure that we don't place people in this type of situation where they have to ask anyone and everyone to give them a helping hand. And I've finished now. I think I've stuck to the 30-second warning. Thank you very much, Mr. Robitaille.
To our questions, Madame Brière, you have 6 minutes. Please go ahead.
Thank you, Madam Speaker, and welcome, and thank you to all our witnesses today. I'll direct my question to Mr. Fleming and Mrs. Lowe. D'ailleurs, je vous remercie.
And I'd really like to very much thank you for all the work that you are doing, in particular during COVID. You are close to elders and people who are more vulnerable, and we're very, very much grateful for what you're doing. Now, you've talked about working in partnership and in collaboration with occupational therapists and nurses and physicians. So how can these partnerships be better developed and implemented, and what could help you to improve this type of mutual collaboration and assistance?
I'll take a moment to respond to that and use this as an example of how collaboration has happened. Our local elder abuse network in London, Ontario, played a significant role in moving London forward back about 6-7 years ago to become an age-friendly city. And through that process and continued process as an example of where multiple individuals, older adults themselves, community members, neighborhoods, agencies, healthcare agencies, social service agencies came together and have really worked on a variety of pillars, including housing, transportation, health, social services, income, etc., in trying to find ways of agencies working more closely together and responding collectively and giving the lead to older adults to let us know in a community what their needs are. And certainly we still have a long way to go, but certainly there have been that as an example of how collaborative work can occur. And certainly as an example, during COVID, we were able to get one of our agencies, Canadian Mental Health Association, to set up a friendly support line to call out to older adults who were indicating that they were feeling increasingly isolated and have friendly calling connecting to them over the telephone, which is at least a piece of technology that the vast majority of older adults do have and are able to operate. So that's an example where community collaboration and agency networking and working together can work. Now, the challenge with that is that all of that has been done voluntarily and really without any dollars connected to it at all. And that shows the commitment of communities across the country that wish to respond to this. But, realistically, volunteer work and that sort of networking can only go so far before more formal interventive resources and the capacity to assess and review elder abuse situations need to be in place.
Thank you. Dans ce sens-là,
So carrying on from that idea, earlier we were talking about data collection, and Mr. Cooper put a question forward on that. In the budget 2021, there's a great deal of money that's been dedicated to Statistics Canada to carry out this type of data collection. Which subjects do you think should be covered? Which areas should we focus on with the funding so that we can better contribute and better help to have the best data collection so that we can improve the situation for our elders?
Thank you for this question. And I think this question is better answered by a group of experts, not we are here serving as content experts in such a brief meeting. I think a group of experts, multidisciplinary experts, should be gathered together to contribute to this idea. And actually, I know that in different universities, in different provinces, experts, scholars have been, working in these issues. It's not that, without without federal funding, without a national strategy, it doesn't mean that the researchers are stop working. So they are doing their work. It will be better to direct it to a group of experts.
Thank you. Alors, par rapport au code criminel.
And turning now to the criminal code, what do you think should be added or amended so that once again we can ensure that we really can cover the protection of elders? I know you've said that you're not a legal expert, but with your experience on the ground, probably you do have ideas about possible criminal code amendments.
And again, I'm going to speak in a regional manner. So in the province of Ontario, as an example, there is no adult protection legislation. And I appreciate that's a provincial level, not a federal level. But what it does indicate is that there is no capacity through law, through legislation, to then set up agencies that can actually go out and assess and respond to potential elder abuse situations. Because even under the Criminal Code Act, it needs more than just the police to investigate these situations. It really then needs to bring in social and healthcare agencies that can look at because most often these issues are multi-leveled. So there are financial issues about it. There are relational issues within families. There may be addiction, health issues. So because of that, we need to have it more than just law itself. It needs to have, again, looking at the determinants of health.
Thank you very much.
Thank
you, Madame Brière. We'll now go to Monsieur Fortin. Monsieur Fortin, voulez-vous commencer pour 6 minutes?
Would you like to kick off for 6 minutes, Mr. Fortin? Thank you. I've got questions to put to Mr. Robitaille. First of all, thank you to all the witnesses for being here. It's always great to hear about what's happening on the ground before we take decisions on these particular matters. Now, Mr. Robitaille, I understand that you're an intervener at the Centre d'Action Bénévole Saint-Jérôme and the Laurentians within my riding, which is the most beautiful one in Quebec and indeed in Canada. So we're very happy to have you here today. Now, Mr. Robitaille, I've understood from what you've said in your opening remarks that you address the economic side of things with elder abuse, but of course there's different types of elder abuse, and we're trying to really discern what we're talking about when we talk about abuse. There's physical, there's psychological abuse, there's negligence. Often we're very negligent with our elders, and there's also economic forms of abuse that you've also mentioned. But I'd like to hear from you about different types of abuse that you've seen in your work in the region and Laurentians. Have you seen physical abuse quite often, or are you more caught up with economic related questions? Yes, it's another important reality, but I don't see this as much in my work. I haven't been confronted so much by this in my practice, but I have seen it sometimes. And I'll give you an example of a situation that happened with us in a file where there was a person who was suffering negligence and was being abused by her granddaughter. There was a family history which was very complicated from a criminal point of view, and this lady was not able to actually complain about this because there was this emotional link with her granddaughter, and also because it was basically the only family member with whom she was still having contacts. So what should we do in that type of situation? That's a good point, because we've often raised this question when there's this type of link and the elder person doesn't want to take criminal proceedings. So what do you think would be the right way to tackle that sort of situation? Well, it is a very big problem, but what I've seen so far in my practice is that you can try and always go for a legal option, but it won't really resolve the problem as such. I think that you need to have legal options, but I think there's lots of other things that we can do before we get to that stage. Once this situation has occurred, I think there's a moment in time where we have to try and protect people in spite of themselves. Now, I don't want to rush ahead, but we don't have much time. Do you have ideas about how we could resolve this? We can organise certain meetings with the people, and then financial management can sometimes be organised, or we can take charge of that to avoid abuse, or sometimes children or grandchildren go on the first day of the month when they get their check to try and get money. But we could try and set up certain procedures that could at least attenuate the situation. There's also certain services that can step in to prevent that. What type of service? Well, for example, people who come in to help relatives but abuse the situation. But if we have the home care services coming in to clean and give them baths, then we're reducing the control that this relative may have on the elder. So I'd like to come back to this question of economic issues, and I've been listening to what you've said on this. So it seems that, according to your experience, elderly people have perhaps less skill than most people when it comes to filling out forms. You've said there's 2 stages. There's the federal and the provincial, and sometimes there's also municipal forms to be filled out. So is there perhaps an organisational problem to try and support the elderly people who are in a different situation from an average person in the population? Am I mistaken? No, you're quite right. I think that's part of the solution. Just to come back to an example that I had with Revenue Canada, at one point there was a person from Revenue Canada who called me up because we're part of this group that tries to help out here. And I said, there's a situation with this elderly person, and there's this question of $10,000, and he doesn't know how to file a return. Can you help him? And I said, yes, certainly. We stepped in. And we got down from 10 to 5,000 just by sending in his returns. So what types of services do we have? What types of services exist to actually support our elderly when they're going through these labyrinths of the federal government? Well, at a provincial level, we can work with the CLSC, the Community Social Service Centre. They have interveners, workers dealing with this. But at a federal level, depending on what's possible, if I turn to Revenue Canada as an example, you've got a great basis of volunteers who are ready to help people with their forms. So I saw this agent who took the initiative and contacted us, and I think that's great. And then we can step in and help. So we need to try and do that before we cut off services to these people, to try and understand what the real situation is. And I think that will already improve their level of vulnerability. They'll be less vulnerable because there will be these initiatives that will be taken before all of this is cut off. And then when it comes to physical abuse, is there a network that can step in and help people in the Laurentians when there's physical abuse? Well, there's the helpline to help with elder abuse, and we're also there, the community interveners. They can contact us. There's also members of the CLSC, the Community Social Service, and the Vigie-Ange. I think that was another organisation that you heard from recently. So there's lots of different organisations, but is that actually sufficient? Very quickly, Mr. Robitaille, or do you think we could try and improve the offer of services? Of course, we can always improve the services, and the interpreter would just like to point out that the witness needs to put up his mic a bit more. It's very hard to hear him. Thank you.
Will do. Thank you very much, Monsieur Fortin. I'll just say to Monsieur Robitaille, if you can just lift your microphone up, or in some way, if you can move it closer to your mouth. The interpreters are having a difficult time hearing you. Maybe a little bit closer. Perfect. Thank you very much for that. Merci, Monsieur Fortin. I will now go to Mr. Garrison for 6 minutes. Please go ahead, sir.
Thank you very much, Madam Chair, and thanks to all the witnesses for their valuable contributions today.
We've heard a lot about the impact of COVID on seniors in institutional situations and the crisis that it produced there, which led to neglect and abuse of seniors. But I'm thankful for the reminder that most seniors do not live in institutional situations. And so I'd like to ask our witnesses about the impact of COVID on the situation of elder abuse of those not in institutional situations. And maybe I can start with Ms. Naveed.
Thank you. And here I would like to just share one of the experiences that we went through that, as I said, like cultural differences between the South Asian community, South Asian seniors and the Canadian culture, that really exists. So the seniors living with their children, they, during the COVID situation, they do face a lot of restriction on their movement, like just to take a walk. One of the seniors, they shared this experience that I do not go even for 5 minutes to take a walk, and I stay within the basement because I don't want my children to blame me if anything happens and if anybody contracts the or exposed to COVID-19 for whatever reason. They may say that I went out and probably I brought that in. So that is the stress and the mental state of our seniors who are going through because of this COVID situation. They don't want to hurt their families. They kind of kill their own willingness to go out. They want to go out, they want to socialize, they want to at least step out of the house to get refreshed, but they do not, just because they don't want their families to suffer and they don't want to get the blames on that. So that is something that has really gravely affected the seniors, and it's just one example, and there are many who do not even go for a walk, or they don't talk to their friends. They don't even go and interact with their own family members because they don't want to be a burden if they contract this disease.
And when you talked earlier about those who were already suffering from perhaps financial abuse or other kinds of abuse, would you say that the COVID crisis has made it even more difficult for them to overcome those cultural barriers in seeking help?
Absolutely. Because, of course, like during this time, they are staying home and they are dependent on the children. The children, they themselves are not some of them have been laid off. Some of them have lost their jobs. So they are also going through some financial crisis. So at this time, if the parents, they kind of ask for any financial support from the children, it leads to further mental stress for both of them, and then that goes to, at times it just turns into maybe that abuse, which can be some oral abuse and some financial abuse, or at times it turns into physical abuse too. So that definitely has affected the seniors and the children also, I would say, like the family members also.
Thank you, Ms. Naveed. I'd like to ask the same question to Mr. Robitaille in terms of the impact of COVID on clients that he works with and their ability to seek assistance.
En espérant que le micro est correct.
I hope the mic is better now, says the speaker. It is. So there's been a major impact of COVID on seniors, the fact that they've had to self-isolate. Well, for 20 years I've been involved in this work, and in these 20 years, the last 2 years, it's where I've been actually forcing people to stay at home. Normally we're fighting to get them out, to get involved in activities, talk with people, and to build their social net. But in these last 2 years, for certain people, all the efforts that we've made have now crumbled, and we need to start from scratch, because the fact that they're self-isolated means that we've got less and less contact with people. If people have an issue, for example, a mental disorder, for example, this problem is now even worse and people become more fragile for the future. So yes, clearly it has aggravated the problem with the various cases that I have observed myself up until now.
Well,
is that okay?
Quickly, in time remaining, can I ask the Canadian Association of Social Workers, either of our witnesses, about the challenges COVID has presented for social workers providing services to seniors?
It has made it challenging because typically, services that would go out and do home visits or see people face to face, that has become much more limited. So in that sense, then that direct connection with the individual, and many older adults don't have computer capacity at home, so the contact may be over the telephone as opposed to a virtual meeting like this. So there is increased isolation. It is causing, from a mental health perspective, seeing increased feelings of anxiety, uncertainty, and that's leading in, and as mentioned by some of the other witnesses, that's the increased isolation is increasing symptoms of depression, and for some individuals that may lead to then increased symptoms of psychosis. So it really is having a major impact, and it's making it challenging for us to do that direct service.
Thank you very much, Mr. Fleming. Thank you, Mr. Garrison. Just looking at the clock, we have 5 minutes remaining on the hour. So I recommend to members perhaps 1 minute each per party. If we're okay with that, we'll start with Mr. Tucker. Please, you have 1 minute, sir.
Okay, thank you very much. Just briefly, I'd like to thank the witnesses, your expertise and your work in the public service that you do. Thank you very much, especially during these trying times with our seniors. We talked about how the impacts of COVID has had on seniors, and to Madam Naveed, I'd like to hear on what experiences you've had with seniors getting the vaccines right now, if there's any stories of troubles, and it's indirectly abuse if they're not able to get fully vaccinated, if you've seen or heard that.
In 30 seconds. Oh, you're on mute.
Yeah, can you hear me now? Yeah. So as I said, that we have been working on the for the awareness and for the prevention of social isolation, and for that we've been conducting Zoom meetings weekly. And throughout these Zoom meetings, we have made it a point that we educate the seniors who join us, around 20-25 per week, to be able to know the impact of COVID-19, how to prevent from contracting it, and all those safety measures they have to take. And during that, the vaccination part has also been a very, very important aspect that we have covered. And for that, we made sure that we give them the information, exact information, because the president of our organization, he is a microbiology PhD, so he really does the research, and he provides very researched, accurate information to all those seniors. And during that, we have seen that the family has really cooperated. I won't say that they have been abused, but not in our experience. The family has been very, very much cooperative for all the, the information that they got. And that was also from the government that they provided. Thank you.
Thank you very much, Ms. Naveed. Thank you, Mr. Tucker. That concludes your 1 minute. We'll now go to Ms. Yip for 1 minute. Please go ahead.
Seniors in my riding, Scarborough Agincourt, come from a diverse background, and many of which come from a culture that carries a deep respect for elders. Despite this, we know that elder abuse rates are higher in the racialized communities, and especially for women. I'm just aware that there are cultural sensitivities that may discourage victims from reporting elder abuse. So I'm just wondering, in your experience, what are the best practices in navigating these cultural sensitivities and engaging with diverse communities in a meaningful way?
Is the question directed to me?
To Ms. Liu.
Oh,
Thank you, Ms. Lip, for this yep, sorry for this question. Yes, what you mentioned is actually extensively addressed in the literature. Racialized groups has significant problems with elder abuse, and to my knowledge and also theoretical elaboration, that's why we address the collaboration among multiple disciplines. In the literature, the elder abuse happened in multiple, in diverse cultural backgrounds. It is for example, language tutors were notified that first, as opposed to elder abuse cases in other racial groups. It is the health professional who would identify first.
Thank you.
So that's one of the things. Yeah. Thank you.
Thank you very much. We'll now go to Monsieur Fortin for 1 minute.
Merci, Madame la Présidente.
Thank you, Madam Chair. 1 minute goes fast, so we won't be able to cover everything we'd like to raise. But quickly, I'll turn to Mr. Robitaille. I'd like to hear about the difference between the reality in big urban centres such as Montreal, Toronto, or Vancouver, and Quebec City, and the reality in smaller towns out in the region such as where you're working in Saint-Jérôme. The difference, well, if we look at Saint-Jérôme and the other towns around here, we've got a double problem. We've got the rural area and the urban area that have two different approaches in these two different zones. In the urban approach, people are isolated, but at the same time, things are accessible, things are easier. Whereas when you're in a rural zone, there's a question of accessibility to services which is difficult because of the distances. For example, when it comes to food bank help or just for getting access to equipment. And then what happens with people in regions? Yes, all this is becoming problematic, but when it comes to access and distance and internet, yes, that can cause issues as well, as you've said. But what I've seen with elderly people, that even if they've access to internet, using it is a different kettle of fish. For example, different applications for doing their shopping, it's complicated.
Thank you very much, Monsieur Fortin. We'll now lastly go to Mr. Garrison for a minute. Please go ahead.
Thanks, Madam Chair. I just want to go back to the Canadian Association of Social Workers and follow up on services to seniors and ask about social work services for those who live in institutional situations. Are social workers generally on staff at institutions for long-term care? And have you noticed a difference between the availability of services between profit and non-profit long-term care homes?
I can only speak from an Ontario perspective on that because it is different from province to province and territory. In Ontario, the Long-Term Care Act is very vague in the level of social work service within the legislation. So basically, there is no specific mandate that long-term care homes have to have a social worker on staff. And in fact, the majority of them don't have a social worker on staff, and so they would hire out. And they may actually hire a social service worker as opposed to a higher educated social worker. So much of the psychosocial issues for older adults in long-term care is not properly dealt with.
Thank you. Thank you very much, Mr. Garrison. And with that, I'd like to thank all of our witnesses for your very compelling testimony this morning. We really appreciate your contributions. If there are clarifications or additional information you'd like to provide, please do send it in writing to our clerk of the committee, who will then circulate it to members. Thank you again very much, and we'll suspend briefly as we let in our second panel of witnesses. welcome to our witnesses for this afternoon's panel on our study on elder abuse. Just for the benefit of witnesses that are just joining us now, I'd like you to just take note of the interpretation icon that's at the bottom of your Zoom screen. Just select the language that you'd like to listen to. You can speak in any language, French or English of your choice. And when you are speaking, just ensure that you unmute yourself, speak slowly and clearly. And when you have finished speaking, make sure that you put yourself back on mute. Please wait until I recognize you before speaking. And I have these time cards of 1 minute and 30 seconds to help guide you in your opening remarks and your questioning. With that, I'd like to welcome our witnesses. We have the Canadian Indigenous Nurses Association, represented by Marilee Naujesik. My apologies if I said that incorrectly, who's the Chief Executive Officer. And we also have the Canadian Nurses Association, represented by Michael Villeneuve, Chief Executive Officer, and Miranda Ferrier, who is the Chief Executive Officer, Canadian Support Workers Association. Welcome, and just before we get into it, I'd like to wish all of you a very happy Nurses Week. We really do, on behalf of our committee, appreciate all of the great work that you do in keeping us safe and healthy. Thank you for your contributions. We'll go ahead and start with the Canadian Indigenous Nurses Association for 5 minutes. Please go ahead.
Thank you very much, Ms. Khalid. My name is Marilee Naujesik. I am the Chief Executive Officer with the Canadian Indigenous Nurses Association. I am in the unceded Algonquin territory of the Anishinaabe people. I am here in Ottawa. I am originally from Thunder Bay, Fort William First Nation, and I am an Eagle Clan member of the Ojibwe Nations. I'd also like to recognize today is Indigenous Nurses Day. So I extend acknowledgement to all of the Indigenous nurses across the country, whom we are the organization to represent your voice. I would also like to just give you a little bit of a backgrounder to CINA. CINA is the oldest Indigenous organization in the country, celebrating this year as 46 years. As well, we have at this point, roughly 9,800 Indigenous nurses across the country whom have identified as being First Nations, Inuit, or Métis. We have concluded that there is probably quite a lot more in that particular area because of the unique identifier situation that we face in Canada. Many workers are apprehensive about identifying in the Indigenous category for various reasons. One, which we will step into in June as we address the third roundtable on racism. However, today, I thank you for the opportunity to come and speak with you in regards to elder abuse in the Indigenous population. And I would like to thank and recognize Mr. Virani for bringing forward the motion to the House to look at this very important issue in Canada. Indigenous elder abuse in Canada is part of a recognized land issue. And we need to, first of all, take a look at the definition issue of elder. Elders in Canada, in the Indigenous lens, are those people who have been given insight and understanding, as well as communication skills to pass on the collective wisdom of generations that have come before us. You have heard from many of our elders, First Nations, Inuit, or Métis, in your previous work within your constituencies. Elder is capitalized when used to indicate honor or a title, which in converse to senior as identified in Health Canada's definition. The global statistics are lacking and the abuse of elders is grossly underreported worldwide. Several countries, including Canada, have carried out research to examine the issue over the past several decades. There is no way of knowing whether abuse and neglect is getting worse or better. especially in Indigenous communities. While statistics on the abuse of our elders are scarce, the general Canadian population and the information is less available for the Indigenous elder population. Having said that, the definition of elder abuse has also some contributing factors when we're looking at the categories of elder abuse: domestic elder abuse, institutional abuse, or self-neglect. Because of these categories, we also look at types of the elder abuse that is prevalent in our Indigenous communities: physical, psychological, and financial. And the most egregious forms of this abuse was evident when we saw the settlements to our Indigenous elders as a part of the Indian residential school system allocations. Defining elder abuse also looks at several other areas that we in our Indigenous nursing ways and knowledge want to be able to identify. We want to look at the abandonment, physical abuse, psychological, financial, sexual, neglect, and spiritual abuse. The contributing factors that lead to the elder abuse, the demographic, the stress, the societal factors, and those which also lead to our life expectancy. We know that there are dependency rates, and there is a lack of statistical sources that allow us to really look at that view in regards to the Indigenous population. We would welcome the opportunity to work with you on the report of this study and further with the Indigenous population. Again, thank you for allowing me to come here with you today. Miigwech.
Miigwech, Ms. Nalgijic, I appreciate your testimony. We'll now go to the Canadian Nurses Association for 5 minutes. Please go ahead.
Thank you, Madam Chair. Can you hear me clearly?
Yes.
Terrific, thank you. And thanks to the members of the committee. Good afternoon. I'd like to acknowledge that I'm on the same land as Marilee, my good colleague. It's the unceded ancestral lands of the Algonquin and Anishinaabe peoples, and I'm just so privileged to live here and speak from here today. My name is Mike Villeneuve. I'm the Chief Executive Officer at the Canadian Nurses Association, and I'm joined today and will share my time with Miranda Ferrier, who's the Chief Executive Officer of the Canadian Support Workers Association. As you've noted, it's a special work for nurses as we celebrate National Nursing Week and recognize the courage and commitment nurses have shown during the COVID-19 pandemic. I don't need to tell you that it's not quite the cake and parties nursing week that it sometimes is, but that's the reality we're living today. And I would like to give a special acknowledgement to Indigenous nurse colleagues as we celebrate National Indigenous Nurses Day today. Turning to the subject at hand, CNA strongly believes that as a society, we need to assume a stance of zero tolerance for elder abuse. It's an unacceptable reality that as Canada's population ages, it will require more forceful interventions, a lot more of us heading into that age curve, as you know. As patient advocates, nurses have a responsibility to both prevent harm and provide early intervention to protect older adults. Through their time spent with patients and families across the entire continuum of care, nurses are well positioned to help identify and address elder abuse. Rigorous practice guidelines and screening tools, training, effective monitoring systems and structures to make healthcare workers feel safe in reporting abuse are just some examples of some important elements that need to be put in place. Nursing is a self-regulated, autonomous profession, and a major condition of this privilege is to protect the public and the profession by having nurses adhere to strict professional codes of practice that are underpinned by dignity and respect for patients. Provided by nurses and personal support workers in long-term care is deeply integrated, and we really can't talk about one without the other when it comes to older adults in long-term care. So I'm happy to turn now the rest of my time to my colleague Miranda Ferrier. Thank you very much.
Thank you very much, Mike. I am Miranda Ferrier. I'm the CEO of the Canadian Support Workers Association. We represent approximately 67,000 support workers across Canada. It is an honor and a privilege to speak today on this very important topic. I want to take this opportunity, I know it's Nursing Week, but to commemorate Canada's personal support workers who have continued to step up through our COVID-19 pandemic. We are here to address the ongoing issue of elder abuse, examine the effectiveness of our current laws in fighting elder abuse, analyze ways of penalizing those who neglected seniors under their care, and how to combat elder abuse more effectively in the future. We must first acknowledge the root of the cause, one of the very many roots of the cause. Our personal support workers across our nation are unregulated. Therefore, our elderly need necessary public protections implemented through government regulations. Regulations provide the industry with a stabilizing element and help professionalize and validate the status of the PSWs. A core mandate of the PSW is to protect older Canadians and seniors, and it is surprising that this workforce remains unregulated. Through the establishment of a regulatory model, it becomes clear that PSWs are formally recognized as equal members of their healthcare teams. But more specifically, regulation will provide our elders and the public with necessary protections. If adopted nationally, a regulatory model demonstrates a clear public safety mechanisms for all Canadians, including seniors. Regulation also levels the playing field in long-term care and community care. We are grateful that for the first time ever, the Ontario government has announced that they will be implementing a regulatory body for personal support workers in the province. This is a first step forward to addressing this problem. Thank you.
Thank you very much. You still had about 40 seconds on the clock, but I do appreciate any extra time we can get. Thank you very much, Ms. Ferrier. We'll now go into our first round of questions, starting with Mr. Moore, I believe.
Okay, thank you, Madam Chair, and thank you to our witnesses. Wish you all a happy National Nurses Week, as our chair has already said, and as well happy Indigenous Nurses Day. We want to commend, the work of nurses throughout the country and indeed throughout the world over this past year, the extra strain of
Sorry,
of
Ms.
COVID.
Moore. Madam
Yes.
Chair, we don't have translation because I think one of the witnesses have open mic. The mic could be in the House of Commons in Ottawa.
Thank you, Mr. Lazon. Can I please ask for Mr. Clerk to just check in to see if all...
not being a legal expert, I won't venture too far into this, but I will say that there are a number of safeguards in the criminal code as we see it and understand it, and strengthening those, but also enforcing those at the level of both the individual practitioner, but at the organizational level, we believe would go a long way to help the cause. I'm not expert enough, Madam Chair, to suggest whether or not there needs to be amendment to the criminal or additions to the criminal code, because the conditions that are there seem to be enough to safeguard if they're properly deployed. I'll stop there so I don't just wander.
Okay, Ms. Nogesic.
Thank you very much, Mr. Ronnie. If the current socioeconomic conditions aren't addressed as far as for the Indigenous population, then the violence against all members of that Indigenous community, and especially the most vulnerable elders and children, will continue at its present rate and will increase. So therefore, addressing the criminal code, which impacts the ability for the National Indigenous Policing Services and the Royal Canadian Mounted Police and the law enforcement and the legislation for Indigenous nurses, will provide that opportunity for better reporting systems, incident management, patient safety, quality and improvement. And data collection is something which comes from the First Nations, because we know that we have the First Nations Governance Information Center structure. In order to facilitate the raw data that will help in looking at treatments, programs, services, licensure, mobility of our Indigenous nurses, then we have to look at those pieces of policy, legislation, and regulatory affairs that govern Indigenous healthcare providers.
Okay.
Across the country. Thank you.
Thank you for that. And I want to bring Ms. Ferrier into the conversation, so I'll turn to you first. But this next question is about sort of the nature of who needs to be the focus of any potential criminal code changes. And we've heard a little bit about this over the course of previous days, but it's this idea that should it be the individual PSWs or nurses that are potentially criminally liable, or should the sort of the nexus of the offense or a strengthened offense be more focused on the people that are managing institutions, directing institutions, et cetera? So I presume I might know the answer, but I want to hear your perspectives. So how about Ms. Ferrier, Ms. Nogesic, and then Mr. Villeneuve?
Thank you very much for that question. I think I've been asked this question many times before. It's something that we as an association federally and provincially have looked into because nowhere across our nation is it the same. So, I'll give you an example is here in Ontario where I preside. In Cambridge, where I live, there really is no senior abuse unit for police. So someone might, and this is an issue we've come across many times with personal support workers in community care and in not long-term care, but community care, becoming, POAs, powers of attorneys for people taking advantage of situations. Some police forces find it as, then it's civil matter, not a criminal matter. So we need to look at as a whole. I think it depends upon where they work, where it be nurses or PSWs, whether or not the individual would be the one that would be responsible or be charged for whatever it is. And I think that operators of long-term care homes or management should also be held accountable depending upon where they work.
There's only 30 seconds left, so brief answer from Ms. Nogesic and from Mr. Villeneuve, please, on that point.
If report is going to be identified in the Indigenous community at that level, then we have to think of a safe space for them to quickly go to. Once it's reported, how do we evacuate that nurse, the person, the people involved?
Sorry, Ms. Nogesic, we missed that last part of it because I think you were muted, so I'm not sure if you want to repeat yourself.
Not a problem. Thank you very much. It was to extract them, evacuate the people from any further harm. So it's removing all parties. Thank you.
Thank you very much.
Okay.
Yes, that concludes your time, Mr. Virani. We'll now go to Monsieur Fortin for 6 minutes. Please go ahead.
Merci, Madame la Présidente.
Thank you, Madam Chair. Once again, thank you to all of the witnesses that are here today. This is a cause of concern for all of us. I think this question of elder abuse, and it's very useful to get these different viewpoints. I think that's very wise. So here I would like to turn specifically to the question of the First Nations. In my imagination, perhaps, I always thought that in the First Nations, they showed a great deal of respect towards their elders. That's what I've always felt. So I'd like to hear about this from you. Do you think that seniors that are members of First Nations, do they have different treatment compared to what we find in the standard civil society? And perhaps Ms. Nalgezik, could you take this question, if I'm pronouncing your name properly?
Merci beaucoup, Mr. Fortin. I'll try to look at what it is in regards to the First Nation specifically. And in that community, we've been inundated by an exhausting list of external factors: drugs, loss of jobs, monies. And under this current COVID environment, the fact that people are restricted once again to maintaining no other contact outside of their community. So we're then seeing an increase in domestic violence. We're seeing child abuse. We're seeing people not having resources available. First Nation elders are held in esteem in a greater portion of the communities. However, because of whatever socioeconomic conditions, mostly those financial, the elder becomes a victim of constraint, limitation, and restriction. And it's those type of abuses, and we've seen them, we've heard them. We heard what happened when the Indian residential school monies came out. That was why power of attorney documents came forward. But what didn't come forward after that? The identification and requirement for wills for these elders. Who does the money go to? Then we've got people fighting in the community. But for the most part, the elders, because of the wisdom, because of what they have obtained, and we're now moving into a new generation of elders whom have a different level of ways of knowing. And that will become part of what will be a policy, political, and legislative structure as we move into the 21st century. Thank you, Mr. Fortin.
Merci, Madame Nalgezik.
Thank you very much, Madame Nalgezik. So is the reality the same for First Nation elders living on reserves or if they live in an urban centre? Is it the same reality?
It is the same reality, and I think it's even increased as far as when they get to an off-reserve environment, because then the societal values and factors that come into play, they become victims within what was supposed to be a safe space for them. Their ability to catch a bus, their ability to sit on the road and wait for that bus to come, and then somebody takes advantage of their frail mental state and says, "Oh, hi, Auntie, I'm so-and-so, I'll take you for a ride," dumps off Auntie and steals her purse. What does Auntie do then? She doesn't know how to use a phone. She doesn't know what to do. That is the reality. That is what's still happening. And unfortunately, law enforcement is saying, "Oh, well, it's out of my hand, report it back to your chief." It's those kind of complacent attitudes which frustrate the nurses even more, because then it's, what medications did you have? What were you in place with? And then the nurse is inundated, and we have to look at protecting our nurses because they are the front line for that trust and that traditional approach between Western and traditional medicine. Hope that answers.
Et qu'est-ce que, à votre avis,
And in your opinion, how do you think we could better protect elders that are living on reserve? Can we do something to better protect them? And if so, should the solution come from the band councils, or should there be a solution offered by the federal government? What's your view on this?
Thank you very much for that. That's called the dream list for the elders. They would like to see elder lodges. We would like to see an elder lodge placed in all 637 First Nation communities across the country, and the ability to staff them with every kind of health healthcare professional that we can within those facilities. And it is a federal government responsibility. It is because they have the facilities management, the infrastructure. We need to hook them up with internet. This is going to be a new generation that will be part of FaceTime, Facebook, and any other technological advancements at their disposal. Thank you.
Okay. Et peut-être rapidement.
And then quickly turning to Ms. Ferrier or Mr. Villeneuve, her colleague. What do you think we could do to improve the situation for elders throughout Canada, and in particular when it comes to their economic security?
I'm not sure if my colleague is still here. He might have been having some internet problems, but I'll take it first. Thank you very much. I think we need to look at, for their safety, their economic safety, is we need to look at how do we provide them with the best care possible, safe care possible, so that they can flourish where they are. I truly believe that we need to have better reporting systems, data collection systems, as was talked about earlier. We need to have education, and not just education of healthcare workers. And I can tell you from a personal support worker, as I am one myself and have been one for 16 years, I had to source out my own education on elder abuse. You know, the public is not aware of the signs and symptoms of elder abuse. Thank you.
Thanks very much. Merci, Monsieur Fortin.
Thank you, Mr. Fortin.
Mr. Garrison, for 6 minutes, please go ahead.
Thank you very much, Madam Chair. And I too want to thank the witnesses for being with us, especially during Nurses Week and also Indigenous Nurses Day. I also want to thank them, obviously, for the work that their members have done over the last 15 months, but also for the work that I know they'll do when the rest of our society moves on from the immediate COVID crisis and the impacts are left to their members to deal with. I want to start with a question to Ms. Nojicic about services and supports available to Indigenous seniors who live off reserve. In my riding, more than half the Indigenous population is urban and off reserve. And certainly I've heard a great deal, especially during COVID, about the lack of services for those seniors.
Thank you very much, Mr. Garrison. In regards to that, that becomes the jurisdictional issue, and that's a game that we're trying to get it to stop between the healthcare provider having certain powers available to them. And why is there no Indigenous healthcare access center within those areas? Why is there no outreach being defined for that? And that's something that we need to address, because it is one of those socioeconomic and societal factors that the federal government, along with their provincial and territorial partners, need to provide some recognition to. Just because, and I mean, just because they moved off the reserve for better quality of life or for whatever reasons, I mean, that's their choice. It shouldn't lessen the availability of what they have to them as far as benefits and services. Then they're getting clawed back. Then when we have them come forward to participate in ceremony, then their old age security is clawed back, and so on and so forth. It's an exhausting cycle. So you can imagine what it's like for a senior who doesn't understand why these are being placed on them. Thank you.
Thank you very much. We have heard testimony, and we've heard certainly in the media, of long-term care operators who have said, well, the problem and the crisis during COVID was a lack of staff and a lack of skilled staff. And I've described that as acting as if the staffing problem fell from the sky when we know it existed before. So I want to go to Ms. Ferrier to talk about, I guess it's the lack of standards for staffing in long-term care homes and the pushing of work that often requires higher skill levels down to personal support workers.
Thank you very much for that question. That's completely in my wheelhouse to speak about. And yes, the issue, I mean, COVID really brought the issue of staffing to the forefront, which I for one, I'm very thankful for. The issue of short staffing in long-term care facilities has been going back at least 2 decades, and slowly it has just been increasingly getting worse. What we're seeing now in long-term care facilities, especially through the COVID, was number one, the personal support workers are the ones that do the bulk of the work. And what I mean by bulk is the most physical bulk of the work. So we're the ones that perform all their personal care. We help them with their mobility. We help feed them, dress them, toilet them, shower them. We are their main communication throughout the day. And of course, the nurses are just as important, and we work as a very solid team in that environment. But what you have are 2 personal support workers, let's say, to a floor of 28 residents, all with different varying degrees of mental, physical issues. Some might take 5 minutes to help get ready, and some take 30 minutes to help get ready. Nurses have up to 60 to 80, if not more, people to distribute medications to in one shift. It's a really impossible situation in long-term care facilities. And until there's an actual standard, maybe even a standard of a ratio for long-term care facilities, which is what we would hope to see come down from the federal government, is a set ratio in long-term care. So X amount of residents per PSW in long-term care homes, and same with X amount of residents per nurse in long-term care homes. So I know here in Ontario, I sit on the long-term care champion table in regards to the long-term care staffing crisis that we've been having. And the conversations are all situated around staffing and ratio issues. So I hope that answered your question.
And would you think that establishing national standards, either within the Canada Health Act or in separate legislation, would help with the situation across the country?
Absolutely. I have thought that for years. I've said it for years, that if there is a ratio, even if we start with something as simple as 1 personal support worker to 8 residents, that's still too big for the record because of the varying mental health and physical issues. But if we just start with 1 to 8, then we'll start to see a decrease in bed sores, in behaviors. We would see less burnout of the frontline staff because then there would be guaranteed only 8 people they have to care for. Right now, we're seeing personal support workers with 1 PSW to 18 to 20 residents, and that's in an evening shift. Overnights is 1 PSW to 35 to 45 residents. So we need to see change, and I think it needs to happen from this part down.
And as we're the Justice Committee, we've been looking at possible changes to the criminal code. What I think we've seen is the tendency to blame personal support workers when there are cases of neglect rather than to blame the system that doesn't allow them to provide quality care. And I know that's a leading question, but I would like to hear from you on that.
I have nothing to add to that or change. I'm going to be perfectly honest. It's the truth. Because we're an unregulated profession, we're the easy go-to blame. They can throw us under the bus and our college is not going to, get upset and whatever. So yes, I totally agree. And that needs to change.
Thank you.
Fair.
Thank you, Madam Chair.
Thank you, Madam Chair.
Thank you very much, Mr. Garrison. We'll go into our second round with Mr. Lewis for 5 minutes. Please go ahead.
Well, thank you very much, Madam Chair, and thanks to all the witnesses. Once again, fantastic testimony. And I guess I will start to say my daughter works at a long-term care home. So I very much can appreciate each and every one of you. And I would also say as well that I own an outfitting business in the far, far, far north. And so to Ms. Nojesic, probably all of my questions will be directed to you. I will tell you that when you said in your testimony, elder with an E, that really, really resonated with me. I'll keep my story short, but it kind of goes like this, and I will only use the first name and I will not give the reserve name. However, I have visited many reserves myself. I will tell you, Irene, I call her grandma, is the most amazing person, as she has taught me so much from far northern Ontario on the Attawapiskat River. And I know that I have spoke to her at length over the last 4 or 5 years, and she's suffering dearly right now because she's stuck in Thunder Bay and she can't go back to reserve because of COVID. So as opposed to perhaps physical abuse to seniors, perhaps we could just kind of switch it and talk about the mental, the mental health issue that those elders off reserve right now are going through. And so I guess my first question is that a fair statement? And the follow-up would be, what can the government do to give nurses an opportunity to help both on reserve and off reserve? Thank you, Madam Chair.
Thank you, Mr. Lewis. Let's just see, I know who. You might get lost. Do you know how insulting that would be? Would you try that on one of your grandparents if they like to walk around? I hardly think not. But in order for us to help with the federal responsibility in looking at the legislation and the impacts of the regulatory and legislative affairs, we need to be able to look at the workforce analysis and we're going to adjust and identify what is the onslaught that's going to be required to adequately, not fairly, just adequately address Indigenous health conditions on or off reserve for the elderly population.
Thank you very much. I know I'm out of time. Thank you very much, Madam Chair, for allowing her to extend.
Thank you, Mr. Lewis. We'll now go to Mr. Lauzon for 5 minutes. Please go ahead.
Merci, Madame la.
Thank you, Madam Chair. First and foremost, I would like to wish you a great Canadian Nursing Week and a great Canadian Indigenous Nurses Day. Thank you very much for your great testimony. That would be very useful for us. As you know, as elders are more isolated and don't have access to in-person services, and here I'm not necessarily talking about those who are in care homes, but even those that are at home, we have seen an increase in domestic violence, whether it's physical or verbal or financial forms of abuse in these sectors. And according to the information that you've got that's available, do you hear from elders that you need your services, and do they confide in you? And if they do confide in you, what type of system can you turn to? And perhaps we could start with whoever would like to jump in first.
Peut-être.
Thank you, Mr.
Ouais, allez-y.
Please go ahead.
Mr. Lauzon, thank you very much for the question. In regards to the in-person services for those elders whom are privileged enough to still maintain within their households, we worry about them at the Indigenous level. But what we have instituted is, you may have heard of Bear Patrol, Mama Patrol, those types of community level services where they engage as law enforcement. However, when incidents do happen and they do occur, the first point of contact with anything that happens on the Indigenous community or in the Inuit hamlet, you run to the nurse because the nurse knows everyone about family composition, who's on what drugs, who's doing what treatment, who's doing this, who's doing that. And we can do that because we don't have enough personnel staff or skilled staff to be able to treat those. That one nurse is working 24/7. And that's why we have to be careful about their burnout rate. But getting back to the issue, when elders do confide in a healthcare professional, such as a nurse, then we have to be very, very cautious about who we confide in the next steps to looking at enforcement or some restorative justice for that elder. Because then we may lose the trust or the confidentiality of other members within the community. So that's why I said we have to create safe spaces, and we have to look at how we're going to train those nurses in that secure situation, how to control themselves so that it doesn't become a situation of chaos and regret. Thank you.
Is there time for me to jump in, Madam Chair? Oh, excuse me.
Thank you very much for that very interesting answer. Now, you've talked about elders that are more vulnerable, and in this case, if they're in centres, well, at home, often the elders are more autonomous, or they may still have a spouse or a family member looking after them if they're still at home. But for vulnerable elders, as a government, what type of tool could we develop so that we can have the right data and intervene to help those who are suffering from some type of impairment or Alzheimer's or a physical handicap which is restricting their mobility, which means they can't move around alone. So how can we intervene as a government to help you with these vulnerable elders?
If I can make a quick comment.
Go ahead, Mike.
Sorry. Thanks, Marilee. I apologize, Madam Chair, for my connection issue. I'll just say that there are a number of tools out there that can help nurses and others to recognize when this is happening. One of the challenges is often we're operating in someone's home. So whether the home is the long-term care setting or in their actual home, there are technologies that we could harness, for example, cameras and so on to help people, or a daily call, daily check-in. There are some of those pieces, pardon me, that can be put in place to help us to make care safer or make lives safer. But I will also add that, and I'm sorry, this may have been covered when I had to be dropped, that our systems are well tuned to capture quality and safety errors, often errors of omission. They aren't looking for high crimes and misdemeanors, so to speak. And so, there's been a terrible example in Ontario of a registered nurse who killed a number of patients and moved site to site. One of the things that the government could do is to push very hard for the healthcare sector to have unique identifiers so that we can track people across employment settings, across careers, and so on. That's absent at this time. And people it might not seem believable, but they can move with a bad record to different places. And that's the government could do. Thank you. And again, sorry for my...
Thank you very much. That concludes your time, Mr. Lauzon. We'll go to Monsieur Fortin for 2.5 minutes now. Please go ahead.
Merci, Madame la Présidente.
Thank you, Madam Chair. I've got a question to Mr. Villeneuve. I'd like to know what should we consider as the best way of dealing with our elders? I understand that there's lots of different issues, whether they're in institutional setting, old people's homes, or in their family, wherever they are, there are certain problems, economic issues or physical issues. But what is the right model that we should promote? Once we've taken account of all of these different aspects, should we focus in on keeping them at home in their families, or for elders, are they better treated, or would they have a better life when they're in senior residences? What do you think? Or perhaps there's a different formula that you'd like to recommend.
I'll try to be very brief. Only about 7% of people in Canada ever go to long-term care, typically the most vulnerable, most frail, often with dementia. So that leaves the other 93% of us, and me at the back end of the baby boom at 62 is getting to that place. The best thing we believe in nursing that we could do is help people to age safely and with a quality of life in the place where they want to be, which is typically, when you survey people, the home in which they live. That can make them vulnerable for sure if they're with an abusive spouse, for example, or an abusive child. But in the main, people say they want to be at home. So if you're asking where do we target our efforts, what can every Canadian expect as they age in their house, in their church basement? What services are there? What do we get from Meals on Wheels? What can we get in palliative care? What is the roster of sort of safeguards and services? Not all high price I'm talking about. Some is technology to check in on people and sort of track them through their aging. Our focus has been very much hospitals, institutional long-term care, and to some degree post-operative home care. But ramping up home care, including simple things like drone delivery of your groceries, is going to, we believe, play a big part in keeping people in place safely as they age. I hope that's somewhat helpful.
Thank you.
Merci, Monsieur Villeneuve.
Merci, Monsieur.
Thank you very much, Mr. Villeneuve.
For 2.5 minutes, please go ahead.
Thank you, Madam Chair, and I apologize. I know people don't think of Victoria as fiercely sunny, but I'm dealing with fierce sun issues here and the camera today. I know we have very little time left, and Mr. Villeneuve was unfortunately disconnected for technical reasons. I'd like to go back to him, something we were talking about while he was offline, and that is the question of how staffing threw long-term care into enormous crisis during COVID. And as I've said many times before, how the operators acted as if the staffing problem fell from the sky. And so my question really relates to the necessity for national standards in healthcare, and particularly when it comes to nursing staff in long-term care situations, and whether his association favors such a move.
We strongly favor it and have been advocating for that for some time. One, I apologize if I've shared this example with you before, but one of the elements that makes hospitals safe is a set of standards everybody follows. And so if you find yourself in the emergency room in Winchester, where I live, or in Grand Prairie, you walk through the door, it looks the same, it smells the same, they ask you the same questions, they use the same technology. You can predict exactly what's going to happen in every emergency room, depending on what your issue is. Long-term care, it's a free-for-all. So strong staffing, very strong standards of care in acute care and so on, highly accredited, regulated settings. And we believe that the same must be held true for long-term care, where the staffing is very sparse often. And we can't forget the safety often in nursing care is vigilance of the number of eyes. Like, you can only see so many people. So if the staffing isn't great, whatever the categories, it tends to lead to trouble.
And in the experience of your organization, have you noticed a difference between profit and not-for-profit long-term care in terms of the number of nurses who are on staff?
There are some reports that for-profit settings tend to, because they're for-profit, they tend to maybe sometimes skimp on some of the services. But when we look at the actual science, it's not that simple a story. And, it's tempting for us, because we tend to land on the side of Medicare, to say there shouldn't be anything for profit. But what you do find, actually, some of the for-profit places are very good, and some of the not-for-profit are not. So I think it's to tease out what are the elements that work in those settings and put those in place in both.
Thank you. Thank you very much, Mr. Garrison. And at this time, I'd like to thank our witnesses for your very compelling testimony today. I really appreciate your time. If there are further clarifications or additions that you would like to provide the committee, please do send a note to our clerk so that he can distribute amongst members. Thank you once again. And to members, I would ask that we quickly disconnect and rejoin in an in-camera meeting. You have been emailed the link. So please do that. It's a very brief, hopefully, meeting in camera to discuss draft instructions for this elder abuse report. We'll suspend the meeting and go in camera. We'll see you on the other side.
Madame la Présidente, un point d'ordre.
Madam Chair, just a point of order. I didn't get the email that gives the link for the in-camera. So if I could please be sent that by the clerk.
Absolutely. Mr. Clerk will forward that to you right now.
I think it needs to be sent to everyone again.
Okay. To everyone, Mr. Clerk, if that's okay.
Merci.
Thank
you. Thank you.
Thank you, Madam Chair.
We'll suspend the meeting, and thank you very much. And we'll see you on in the in-camera meeting.
you.